Good evening, you're watching The Last Word. I'm Sanjana. We've been bringing you updates of preparation, of screening, fresh cases unfortunately, but tonight we're also going to be doing some talking to people who are in the comfort of their homes, but also far from their home, India. Now the situation is different in Korea, it's different in Italy, it's different in Iran. And while the government is doing everything to bring these people home, maybe we can speak with them and understand how the country they are in is dealing with this, and more importantly, check on them, see if they're doing okay. Then at 10:30, we will also be taking your calls, taking your queries, just like every day, hopefully putting whatever concerns you have to rest. So feel free to call the numbers flashing on your screen. Our call lines are open. We're also going to try and understand what, as common people, we can do now. How can we live well in the time of coronavirus? So let's get right into it and speak to my panelists. Joining me from the world over first, I have Shola Carletti joining me from Pesaro in Italy. She's an Italian artist but works and stays in Pune in Maharashtra. India is her base. We understand she was away in Italy for a break. She's unable to come to her home in Pune. I also have Mafi Irish joining me from Turin in Italy. She's an Indian student at the United Nations Inter-Regional Crime and Justice Research Institute. Dr. Aritra Banerjee joining me from Pohang in Korea. He's a scientist in Korea. He was in quarantine. We're going to try and get in a word from him as well. And Divya Mandral, she's going to be joining us as well. But she's going to try and joining us as well, and she's a teacher of English literature. We'll try and get her on in just a moment. But first, let me come to you, Shola. You know, we've been bringing stories of Indians stranded all across the world. But in your case, it's slightly different. I understand that your base is currently in Pune. You were visiting Italy. Can you take us through your experience and where you currently are?
So I live in India since many years, and so I work and live there. And I just came to Italy for 2 weeks because I had to sign some documents, and I was ready to go back, to come back to India. But as you know, all the visa got cancelled, and so I'm stuck here, and it's really disturbing, the whole situation, because when I came here more than 2 weeks back, the situation was not so serious. So it built up very, very fast. And now we cannot go out from our home. We are compelled to stay inside the house. We need permission to go out. We need to have a written permission to go to the grocery. We have to make a certification to go out, to do everything. And so the rules are now very, very strict, because in Italy, we really don't want the virus to spread more, because we are already, all the hospitals are congested.
Okay, my heart goes out to you, and you know what you're actually going through, and actually everybody here on this panel.
Yeah.
Dr. Banerjee, let me come to you. The situation obviously in Korea is fairly grave as well. So what have you been doing to deal with it? How has the government responded to it? How long since you've been in quarantine? Take us through those details.
Yeah, so first, thanks for having me. But in Korea, the situation up to mid-February was pretty okay. We only had like 30 cases, and everyone was fine.
Okay.
And then suddenly, within like 4 or 5 days, there was a huge spike.
Yeah.
I live in a place which is like only 1 hour away from the epicenter of the outbreak in South Korea, Daegu. And immediately, within 2 days, there was a case in my town. And within another day, there was a case in my institute where I work, and I was exposed to the virus without even knowing it. So the whole institute was immediately put into quarantine for 2 weeks. And the institute and the local health authorities were extremely helpful. They put everything in order. They were keeping in touch with us every day to inquire about our health. And the local government was also very helpful. They sort of provided us with supplies for all these days and kept watch over us. So in these 14 days, I was completely at home. I could not leave. I was completely isolated, and it was mentally extremely excruciating, to be frank. So I only got to go out after 9th of March, that is this Monday. And by that time, I think South Korean government had a brilliant response to the coronavirus outbreak here. And as you might know, that things are already things are already becoming more stable as days are going by.
Right.
Yeah, so I think the South Korean government dealt this with a very novel way. They had this slogan called test, trace, and treat,
Okay.
where I think in last 3 weeks, they have tested 250,000 people. Um, and for that, the number of cases that they had grew very fast, but they could also trace all the contacts and put them in isolation and treat all the people who needed treatment.
I think that's quite clever. Test, trace, and treat. And I'm just going to ask a follow-up question before I actually come to Mafi. You said that you got out on the 9th of March, which is what, 3 or 4 days ago. What was that feeling like to step
Oh,
out in the open? What was the first thing that you did?
I first thought that all the shops will be closed and there will be no one on the road, but it seemed that the South Korean government has sort of encouraged people to keep everything open and return to normalcy as much as possible. So I went out and I could see that people were still out, but they were extremely cautious. Everyone was wearing masks and
Right.
things like that. But somehow things were open. The supermarket still had food. There was no panic buying. So it had some sort of despite all these problems, it still had some sense of normalcy, some sense of there was no chaos.
Okay.
This is what
That's enduring, I feel, in a time like this. Mafi, is it the same in Italy? Because I understand, as per reports, you can obviously confirm it, that only chemists were open and only supermarkets are open in Italy because of what's happening right now. How are you going out and getting your essential items? What has your experience been like so far?
Very good evening to you, but it's unfortunately not a very good afternoon from my end because I appreciate the fact that you said it's nicer to check on me, and I feel that a lot of people who are watching me are checking on me, and it's very reassuring. Unlike the previous panelists, things are not very normal here. Personally, I feel mentally drained, devastated, disheartened, and I've been panicking for the past 2 weeks. I'm not, unfortunately, a classmate of mine was tested corona positive.
Okay.
And so we're advised to self-isolate, apart from the fact that we're on quarantine. We have to self-isolate for 2 weeks. So as a responsible human being, I don't want to be a transmitter. So I've isolated myself in my room for the past 2 weeks. And more than corona, the anxiety that I have is a killer. With regards to the facilities that are available to us, like I said, I've not gone out to get my shopping in the past 2 weeks. I've already piled up things the previous week because I know that something was coming up. I haven't managed to go into the supermarket yet, but I'm told that there is a long queue in every supermarket. And if you have to purchase vegetables, you have to use your gloves. And we have this 1 meter distance rule. So there's a security guard outside and letting people just one by one. Yes, you're right. The chemist is open. The restaurants are closed, so after 6 a.m., nothing. There are some online delivery systems that are open and available to us, but life is not very normal here. And at this point, I don't feel optimistic about anything, be it my physical well-being or my career or my future in Italy. I've studied in London for 5 years, and studying abroad has always been illuminating for me. But right now, it's a nightmare. It's a nightmare.
Mafi, I'm so sorry to hear that, and I hope you're feeling. I hope just by doing this and coming out and knowing that you're not alone, and there are people who are joining you from other parts of the world, and that we're always looking out for you. I hope that makes you feel better, and I hope that you are also exploring resources to deal with that anxiety. And I can understand how crippling that must be when it comes to your career and how you're feeling physically, but just rest assured, just know that this is not permanent. It's going to be temporary.
I understand. Yeah. I understand it's an act of God, but my bigger worry is, I live in a 5-bedroom flat, and my other flatmates were Italians and one is French. So when they came to know about the corona situation, the local Italians have gone back to their house, and the French flatmate had vacated her house. So right now I live in a ghost 5-bedroom house, and I feel lonely. I cannot explain how daunting and traumatizing it is. I'm an independent woman, but I think quarantine for 2 weeks in a 5-bedroom house all by myself, if something happens to me, nobody would know. I don't want to panic anybody, but this is just the reality. Of course, the government is trying its level best. I understand that there's a plane going to come on Saturday to take us, and I also understand that in Rome there are medical facilities available to us, but the only difficulty is that Rome is 700 kilometers away from where I am, and I think Indian students are spread across Italy this way, and the only place where we could go and avail that medical test is only in Rome. So traveling, commutation, going and getting the test done. And if I'm not right, I've been speaking to the authorities as well, and they told me that only if I want to go back to India would they test me, and once the test is done, within 24 hours I fly back. But the difficulty is we are still having our classes online, so we've got the webinar sessions and online tutoring, and I have an exam on Monday. So if I do decide to go back on this special plane, which the government is more than generous to help us and rescue us, I would not be able to take my exams. And the whole point of me coming to Italy and pursuing my career, potential career in the UN, because I joined this course, I think at this point is a big question mark. And I don't want to be on that plane missing my exam. Between my life and my career, I'm just confused as to, what I should choose. And I don't know. I'm sorry. It's
no, that's all right. That's all right.
Yes.
Thank you. I hope it it resolves itself soon. And I'm sure perhaps if you can have a word with the people at your course. Before I actually come to anybody else, I'm just going to quickly cut across to a feed that we're getting in of Justin Trudeau. Let's remember his wife tested positive for coronavirus. I believe he's addressing the media as we speak.
Help Canadians. We recognize there is much more to do. We do not want any Canadian to have to worry about whether or not they're going to be able to pay their rent, whether or not they're going to be able to buy groceries or care for their kids, or elderly family members. We need to make sure that Canadians have the options and the ability to follow the best public health advice and keep themselves safe. That is what we are focused on, and we will be rolling out those measures in the coming days. The Finance Minister will make further announcements later today on concrete measures to support our economy. But further to that, in my conversations with my fellow G7 leaders, we have agreed that it will be important for us to coordinate at a G7 level to impact the global economy. And we will be continuing to follow up on those conversations in the coming days as well.
Are you considering direct financial payments to Canadians or to affected industries?
We are looking at ways to help Canadians directly, yes, particularly vulnerable Canadians who are going to be particularly squeezed if they aren't able to go to work. These are the kinds of things we're focused on. We also know that small businesses may struggle through or will struggle through this period of economic slowdown, of people choosing to stay at home and protect their families. We will look at how to support them so that once we get through this difficult time, our economy and Canadians will continue to prosper. Okay. Nous regardons comment on va aider directement les Canadiens qui seraient dans des situations
Trudeau,
plus
the Prime
difficiles.
Minister of Canada, who is addressing the media. Let's remember his wife has actually tested positive for coronavirus. So hopefully coming out there and reassuring the Canadians after this coronavirus outbreak. We're just looking right now at our panelists who are joining us from all over the world as we currently speak. We have two guests joining us from Italy and Dr. Banerjee also joining us from Pohang in Korea. Let me come to you, Shola. I understand, as Mafi was rightly pointing out, that Italy after China is particularly bad. Her feeling of feeling anxious and obviously unsettled is also understandable. But just take me through the kind of measures that perhaps the government may have put in place with regards to how you're getting internet, your normal life, where you're getting your supplies, your groceries from. Has that been impacted badly?
No. I think that it is definitely not comfortable to be in this situation, but we don't miss anything. We can still get our grocery. There is no, all the food, all the industry regarding food are working. So we have veg and fruits, and we can, as she said, we have rules. We cannot go more than one person for family to the grocery store. We have to keep the 1 meter distance rule. We have to wear gloves to protect ourselves. So there are many measures that we have to take in order not to get infected. And of course, I'm very happy to follow all of that, because I don't want me or any of my family here to get in the position to be hospitalized. But we have, it's not war. We have internet, we have everything that we need. And the main thing is that, many stores are closed. Only the necessary things are open, and you can even walk a little bit around the house, not too far, because they don't want people to go around. They want to prevent the situation to get worse. And for that, we have to stay at home, full stop. We don't have to get in touch with other people. And I think that if all Italy manages to stay put for 2 weeks, I think that we also will be able to reduce the number of people who are hospitalized. Because the big issue is many people can get infected and get over it, like having a flu. But the real problem is that more vulnerable people get in a much worse situation, and then they need ventilator, and all our hospitals are congested. They are full of people who are hospitalized for a long time, because it takes pretty long, weeks, to get over if you get into a ventilator. And many other things in the hospital are not working. They stopped to do chemotherapy for cancer people. They stopped to do other things because all the effort in the hospitals in Italy are focused to contain the coronavirus. So this is pretty serious. That's why we need to do our best
Right.
not to get the situation worse.
And I think I absolutely appreciate your determination there. It's probably reassuring to a lot of people who are watching this show, who are and understandably so, who are disheartened by what's happening. It is easy to panic, but Shola, I think your attitude is inspiring. Let me also quickly say good evening right now to Divya Mandral, who's also joining us from the southern side, Aberdeen in Hong Kong. Divya, good evening. Thank you so much for joining us here on Mirror Now. We've just been trying to understand, what the situation is currently like, where you are, whether you'd like to come back, and more importantly, if you're doing okay. Are you doing all right?
Yes, I'm doing okay, and I hope the same for everyone in India as well.
Yes, we're pushing through.
Yeah, that's good to know.
Okay, so just give me a sense, Divya, of what the situation is currently like in Hong Kong. We were talking about how bad it is in Italy. Dr. Banerjee was talking about how he was quarantined. What's the situation currently like? Are you getting access to your groceries and other essential items? What about public transport? So give us a sense of what's going on.
So basically, the threat level to Hong Kong is pretty huge, considering that there's a lot of inflow from China into Hong Kong.
Mm-hmm.
So this happened back in January when they declared that Wuhan would be under lockdown. And that's when the panic actually started in Hong Kong, because that was also the time where there's a mass migration in China that takes place because of Chinese New Year. But the government was actually really fast to react, because the moment everyone found out that a virus has started spreading, over here people went into the panic mode, and actually all the surgical masks from the pharmacies were gone. And at the very beginning, we had a lot of trouble getting basic necessities, like there were a lot of rumors regarding the toilet paper, and sanitizers weren't available. So I remember that in February, queuing outside of grocery stores and pharmacies, and they would hand out tokens. If you were lucky, you would access the sanitizers. Otherwise, you would just be standing there for 2 hours, and you'd have to return home empty-handed. I think right now the situation is much better.
Okay.
The fact that people get into panic buying is right at the beginning, and as you can see that it's happening now in the US, it's happening in a lot of other countries.
That's right. That's right.
They're just stuff.
Divya, I'm so sorry to cut you off, but we seem to be having, the audio isn't very clear. We're going to try and, establish a connection with you back again. But, let me also quickly get in a word now with Dr. Banerjee. Dr. Banerjee, just take us through, what's happening in Korea with regards to, public transport. Is that up and running? Is that limping back to normalcy? Some time ago, I believe it was just yesterday or day before, the Chinese government even said that the peak of coronavirus is that they have passed the peak of coronavirus, and now there is a decline, there is a drop in the number of cases. So where is South Korea with regards to the peak? Of course, we heard the WHO right now saying that they don't know that when the pandemic is going to peak. But I believe, country-wise, is there any kind of deduction or any kind of, understanding of where they are currently?
Yeah, true. For South Korea also, I think like a few days, I think a couple of days ago, the health minister has also said that maybe they are also past their peak.
Mm-hmm.
And actually, if you look at the numbers, I think the numbers are declining. The number of new cases are declining every day. And I think today was the day where the number of new cases were less than the number of people who were discharged from the hospital. So that is sort of, gives you a sense that the government is winning in the war. But of course, since you have to understand that the dynamics of coronavirus is such that clusters are extremely important, and one small cluster can grow into a very large number of infected people very fast. So there are those kind of concerns, like there is this cluster in Seoul that they are talking about now, which could grow, but they don't know. So but there is at least a sense of sort of calm that if they can continue doing work like this, things will be normal in some time. And as far as the public transport goes, public transport was hit a bit for some time. But as you know, I spent the peak of the coronavirus stranded, completely isolated in home. So I don't know what happened during that time. But when I go out now, I can see that the public transport is okay. But not everywhere. For example, in the epicenter, in Daegu, the public transport is not really, it's probably limping back to normalcy, as you said, because they still have thousands of cases,
Right.
and there is a chance of reinfection all the time. So the people are just staying away from public transport for now.
All right. Okay. So, I think we've established the connection back with Divya. Hopefully we can hear her better now. Divya, you were talking about the kind of panic buying, and of course, there are unfortunate memes all over the internet with regards to toilet paper. But this is something that perhaps is not only a threat to the world, but also an opportunity, a learning, but a very harsh one when it comes to things like this, where one should not indulge in this feverish panic buying or panic of any sort. So would you agree with something like that? And is that on display in Hong Kong as well?
Yes, I think people have eventually figured out that wiping off shelves in the supermarket is not actually the answer to protecting oneself. And I think right now what we need to be calm. And of course, we need to take maximum precautions because eventually it's all about hygiene. I do understand that when people don't find sanitizers or even basic hand wash when they go to a supermarket, it can lead to some sort of panic. But to be very honest, we already have some stock at home as well. And you are going to continue getting all these materials in the supermarket as well. I think we learned it eventually.
Right.
So now things are more stable. But only because cases are rising in the other countries, we are seeing this panic buying in those places. But I think eventually they will all learn to be calm as well, because we've learned it at the end.
I think that's very valuable advice. Unfortunately, I'm just going to have to shift the discussion. We have some unfortunate news that's coming in. An update right now. We know that India has recorded its second and Delhi its first coronavirus-linked death. It's a 69-year-old woman with coronavirus who has succumbed to the illness at Delhi's RML hospital. She's an elderly woman. Let's remember, just yesterday we reported another death from Kalburgi in Karnataka. The person was 76 years old. He was a man. He had hypertension. He was suffering from asthma and also had coronavirus. But right now, this death coming in from Delhi. Let me quickly bring in my colleague Ayushman, joining me on the phone line with more. Ayushman, unfortunate news coming in. Take us through the details, please.
Well, this is the first death that we are seeing from the national capital, and this is the first COVID-19 death confirmed from the national capital. 69-year-old with other comorbidities. This has been the information from the sources in the Ministry of Health, which has been given to us. And it has been said that it was a 69-year-old woman she succumbed to the comorbidities, and she was admitted, and she has now succumbed to the COVID-19 infection, and this makes her the second death in India and the first death in the national capital. Sanjana, over 6 people have been tested positive, and today the health ministry has said that in fact 7 people got discharged because they were well and they have been completely treated and they have been discharged. Right now, the 81 cases are there in the country, and this is the second death that has been confirmed from the health ministry.
Right, Ayushman, thank you so much for bringing us those updates. Unfortunately, not very good news. A 69-year-old woman has succumbed to coronavirus. As Ayushman said, she succumbed with other comorbidities, which essentially means in medicine, comorbidity is essentially the presence of one or more additional conditions occurring with the primary condition. So just like last night, we spoke about the Kalburgi death. This man was suffering from hypertension and asthma. Today as well, a 69-year-old woman has passed away in the national capital. This is the second such death that is being reported as we speak. Let me quickly, bring the focus back to the discussion now. Mafi, I'm going to come over to you, and thank you so much really for speaking so candidly and, bearing your soul and talking about what you're actually going through. Mafi, do you think that perhaps, even via this show, that the need, besides, of course, looking at, groceries, internet, other essentials, is also to look after, mental health when it comes to the outbreak of coronavirus, because obviously people are susceptible to anxiety, to panic. It's understandable that they're feeling claustrophobic because they're quarantined in spaces for so long. Do you think that that's also the need of the hour, that perhaps that needs to, be rolled out as well?
I'm very glad that you just brought this, but I hope my family and friends are watching this and they don't take it in an adverse way. Corona has actually put me in a place wherein I feel I have split personality disorder, unfortunately, because of the anxiety. I'm just worried and then I'm fine. And, I move on with my day-to-day life. And then again, I get worried even more. So I think in my case, the consequences of corona is not corona itself, but perhaps split personality disorder. And I don't know how to deal with that, but there's something that I should do to overcome it. I think the ideal solution, in my opinion, is that I get tested first. But at the moment, I've reached out to private clinics, doctors, and including, our Indian government to get to know whether I could be tested or not. So at least when I get myself tested, I know that I'm not corona positive. So that would be something where I could relax.
Correct.
And then I also look at a lot of memes, and some of my friends, they started to call me, oh, you're a corona star, oh, you're a corona celebrity. And another friend of mine was just calling me, oh, so you're corona Mafi. It's funny, but honestly it is not, because it just breaks me down both mentally and physically. Like you said, yes, we do need a lot of support, but I think the ideal solution for a start would be to make sure that we are tested, because like I mentioned before, my understanding is I would be tested only if I have significant amount of threshold of the symptoms like coughing, sneezing, my temperature about 37, breathlessness, tiredness, and then I faint. But I don't know. I don't know yet. There is no clarity on us getting tested, and at what point would we get tested? The logistics. We all have to go to Rome. Would they come here, or how is that going to work? That it's just completely uncertain. I understand it's an act of God, and I do not want to blame anybody for this, but there needs to be some solution to this, and we would really be happy if somebody from our government just calls us and finds out that we're okay, we're alive, and just maybe call us and say if we're doing fine. I think simple things like that would be a lot more reassuring. In my case, there's a lot of unnerving sirens of ambulance that's just going across my window.
Yes.
And it's bothering me a lot. I'm not able to sleep in the night. I'm tossing and turning, and it's affecting me physically and mentally. But I would also like to mention that our government has created some application for us where we could register ourselves. So I'm registered on an app called the MADA or MADAD
Okay.
app. But I'm sure they're doing something with it. And for me to expect more at this time of chaos is perhaps too much, or maybe not. But I just hope that somebody gets in touch with us. And there are some Indians with whom we are in touch. So we have a WhatsApp group, and we named ourselves Rescue and Repatriation, hoping that at some point we would be rescued and repatriated for the ones who wishes to go back. But it would be very nice if actually somebody checks on us at some point.
Right, right. I understand that, and I understand where you're coming from, and don't worry, we are concerned about about you, about several like you, of course, who are stranded. I'm afraid that we're completely out of time. But before I go, just a quick answer from Divya. Divya, have you made any attempts, or have you been contacted by the Indian government? Would you like to come back home? Have you heard anything with regards to that?
No, so far we've not been contacted by the government. But I would like to come back because actually the Easter holidays were going to start in April.
Right.
And I thought that I would probably come back home during the Easter holidays. But now the situation is actually getting worse. And you never know whether flying is still safe, or because we keep hearing about cases popping up and passengers taking these flights.
Right.
And you can be quarantined. So situations are changing every day. There's a lot of uncertainty, and it does kind of lead to some sort of stress as well, because you don't know what's going to happen next. But so far, I think in Hong Kong, the Indian embassy hasn't contacted people. Yeah, the situation's still under control over here.
Right. Divya Mandral, thank you so much for joining us. And to my other guest, Dr. Aritra Banerjee from Korea, Mafi Irish joining us from Turin in Italy, and of course Shola Carletti joining us from Pesaro in Italy. I hope all of you are safe, you live well, eat well, and I hope all of this is over soon so that you can return home safely, or at least feel more at home where you currently are. Thank you so much for joining us this evening. And now let's quickly shift focus now to us taking your calls, your queries, whatever questions you have on the coronavirus. I understand it is daunting right now. We've got over 80 cases that have been reported in India. We've unfortunately also reported 2 deaths, but the preventive measures still stick. They still very much stick. You have to not panic. You have to keep your hands clean, avoid touching your face and your eyes and cheeks, don't rub your face. When you sneeze and cough, ensure you do it in your elbow or in your hand. But if you have questions like this or any other questions, our numbers are flashing on our screens. Our call lines are open. Please feel free to call. Let me quickly introduce our guests. Our next set of panelists that are joining us this evening, I have Dr. Jeenam Shah, Consultant Interventional Pulmonologist at the Wockhardt Hospital in Mumbai Central in Mumbai. I have Dr. Vikrant Shah, Consulting Physician, Intensivist and Infection Disease Specialist, also from Mumbai, the Zen Multispeciality Hospital that is in Chembur. Besides this, of course, we're also going to try and understand here tonight about, how we can live better. In the time of coronavirus. Of course, now in Maharashtra, we heard Uddhav Thackeray come out and talk about gyms and swimming pools being shut. We're seeing a slew of measures being introduced by other states as well. So what we're really trying to understand is that, is it more important to go and watch that movie, or do you really need to sit home and watch some Netflix or watch Mirror Now, watch the news? So, this is what we're actually going to try and understand. And if you have any other concerns, like health-related concerns, please feel free to call. Our panelists are joining us this evening. Dr. Shah, let me come to you first. There is a concern that there is a lot of community transmission, which we aren't aware of currently in India because there isn't widespread testing. So, is this a concern?
Yes, absolutely, it's a concern.
Yeah, this is a big concern right
India,
now.
Sorry, that question was for Dr. Jeenam Shah. I'm so sorry. I'm so sorry.
Getting infected.
That question was for Dr. Jeenam Shah. I'm sorry.
Right. Yes. So basically, in China and as well as in Italy, there are a lot of been cases of community transmissions already proven But in India, as of now, we have not reported a single case of community transmission. But yes, as we understand, the incubation period is pretty long. So we know that there might be cases happening between the incubation period. But as of now, we have not reported a single case. But it's definitely a cause for concern. That is true.
All right. Okay, I apologize for that. And, I realize that both of you are Dr. Shah, so I'm just going to go by first names, if that's okay. Dr. Vikrant Shah, is there a likelihood of an uptick in positive cases? Because I believe that is also a question that's coming about as testing capabilities have considerably improved.
Yes, it is likely possibility because we've been getting sporadic cases now. And if we don't really have the contact isolation and quarantine proper, then it is likely to have human to human transmission. So by doing that, there's definitely going to be a scare wherein the cases are going to be increasing in number.
So, Dr. Jainam, we've really discussed this at length on Mirror Now, and actually almost every evening where we've had guests come and talk about what China is doing, what Italy is doing. Just moments ago, we even heard from what's happening in Korea. The kind of stringent measures that they have put in place. I don't believe that that's actually going to work in India. So obviously that's that's causing a lot of panic over here because the way we are structured is completely different. We're overcrowded. Rural regions is obviously a challenge, and hence we can't adopt such a stringent lockdown here. But then is the privatized healthcare expense and the fact that public health hospitals are overwhelmed also an issue? And then what does one do then?
So basically, yes. So we have got the news that 7 hospitals in Mumbai is also going to be quarantining those patients who have suspected COVID-19. So that is a good step by the government that we have got at least now a hospital which is able to cater to a large number of people. Obviously, Kasturba was always there, but this is a new hospital which has come in. So government obviously is doing its own efforts to start increasing the number of beds in case of an epidemic which increases, the number of patients increases. So we cannot do the same thing which has happened in China and South Korea, obviously because it's a different government sector completely. But yes, whatever Maharashtra and the India government is doing is actually trying to cut down on those transmission cases. So yes, Maharashtra have also started today only. They have been closing down the malls, the gyms, and a lot of other gatherings. So that is actually a positive step towards better healthcare.
All right. So I'm just actually going to quickly open the call lines once again and let our viewers know that you can call in with whatever questions you have, whatever queries you have. If you want to know whether you can go to the gym, whether you can see a movie, whether you can send your child to school. These are all valid concerns. Nothing is silly. Nothing is invalid. So please feel free to call with whatever queries you have. We have Dr. Jainam Shah and we have Dr. Vikrant Shah over here to answer anything health related as well. Dr. Vikrant, then let me understand this. India's response to previous disease outbreaks has been strong. But, this isn't a Nipah. It is not an Ebola. So obviously this requires a slightly more sophisticated response because not only does it have flu-like symptoms, but then it also becomes asymptomatic. So, do we have that?
Yes, because we need to have that on board because this virus is definitely behaving differently as against what you mentioned. Though the SARS and MERS were a subtype of coronavirus which had a larger mortality as compared to COVID-19 or a novel coronavirus, but then we do not know in detail how the RNA virus is going to behave. Based on the presentation which we saw in Wuhan, China, and then subsequently and other affected countries like Italy and Southeast Asia now, we know that this virus is behaving differently as against a routine influenza virus or H1N1. So on that context, we have to be more cautious vis-a-vis the steps to be taken. We do not have case zero in India or in Mumbai, but people who are traveling who have been affected and unable to take care of the respiratory and hand hygiene, and because of which other patients are getting affected. So we need to have all the measures wherein we restrict this, so the distancing, quarantine is the key for it, because the deterioration is taking place a little later as against the H1N1 virus. You do not have a fixed proven data how the drug is going to act. Like for example, for H1N1, we have a drug on board which has proven its effect. As against that, what we are using in India is on the basis of how the effect is being seen, but it is still not has the evidence-based data behind it.
Okay, that makes sense. Let me quickly bring in a caller. Now we have a caller joining us from Mumbai on the phone line. Jason calling in. Thank you so much for calling in on The Last Word. Go ahead with your question, please.
Hello, ma'am.
Yes, go ahead.
Ma'am, I'm Jason from Mumbai.
Okay.
Thank you for having me on your panel.
Please go ahead, ma'am. If I can just request you to turn down your television set volume, please, because it interferes with the audio.
Yes. Can you tell me what care do people with suppressed immunity or who are on immunosuppressants for a very long time have to take during the COVID-19 outbreak?
Okay. Dr. Genome, would you like to take that question, please?
Yes, absolutely. So yes, it has been documented in studies till now that people who are immunosuppressed or patients who are having comorbidities are more likely to suffer from severe COVID infections. So it is the same routine hand hygiene, cough etiquettes are the same thing to be, precautionary ways to be done by the immunosuppressed patient as a routine population. So anyways, when you come in contact with a person who is ill, who is having a symptom of coronavirus disease, please keep a safe distance of 1 meters. That is the same thing. Please keep using your soap and water frequently or a hand sanitizer for alcohol. Those are the standard measures, and always a person who is having a disease or is suspected to having a disease, keep yourself isolated from the person who is not having a disease. Home quarantine is the treatment, is the prevention right now. That is the thing which is recommended.
All right. I hope that
when you develop symptoms, the first thing you're supposed to do is to consult a doctor.
Okay. Yes. Jason, I hope that answers your question. Thank you so much for joining us and calling in. I have another caller joining us from Mumbai. Vijay joining us on the phone line. Good evening. Thank you so much for calling in on The Last Word. Go ahead.
Yeah, hi. I drive an Ola cab, so I just wanted to know, there are many passengers sitting in and out. So it is advisable to drive in the AC, or should we turn off the AC, because that could be one cause of spreading because of the AC. So is turning off the AC a solution kind of that, so that it doesn't goes around?
Okay. Dr. Vikrant, would you like to take that?
Yeah, so it's a very valid question. It's not only restricted to air condition, but frankly speaking, if somebody is suffering from the COVID-19, then the respiratory droplets dropping onto the seat or onto the windows also can be potentially dangerous. But as you said, the circulation and the cross air transmission is definitely going to be more beneficial. So without AC is definitely technically going to be more beneficial.
All right. Vijay, thank you so much for calling, and I hope we were able to answer your question. Dr. Jeenam, although a need is extreme social distancing, like the measures that have been taken in China and Italy, possible in India, this is what we were discussing, since it is not what is, the Indian solution, since we have, the Indian answer to everything. What is the Indian solution for something like this?
So, as we have discussed already, I feel that social distancing is possible even in India. So, people who have symptoms can definitely isolate themselves from the community. That is the first and foremost step that an infected individual should be doing. Apart from that, we cannot obviously lock down all our cities, all our urban areas as well as rural areas from what the other countries have been doing. But social distancing is something that we can definitely do. Apart from that, we can have good supplies of regular sanitizers as well as masks, which have been in significant depletion in our masks, which I've seen, which we can make the government provide them. That would be really helpful. Apart from that, avoid all kind of social gatherings, avoid all kind of contact with people who are suspected to having those diseases, something that is going to be the answer.
Right, Dr. Jinam Shah and Dr. Vikrant Shah, thank you so much for joining us tonight on The Last Word. And thank you to all our viewers. I hope we were able to answer your questions and hopefully put to rest whatever queries and questions you have about the coronavirus. Number one, the most important preventive measure, of course, is not to panic. Thank you so much for watching and have a good night.